My name is Brooke Hudspeth, and I am a pharmacist for Kroger Pharmacy and also a preceptor for the Community Pharmacy Residency Program through Kroger Pharmacy. And I went to undergraduate and College of Pharmacy at the University of Kentucky, and then upon graduating in 2007 from the University of Kentucky College of Pharmacy, I completed a postgraduate year 1 community pharmacy residency with an emphasis in community care with the University of Kentucky and Kroger Pharmacy. The community pharmacy residency program is one that's unique. There are multiple community pharmacy residency sites across the nation, and the community pharmacy residency sites are starting to gain more popularity. It allows pharmacists to receive that extra training in the community setting, allowing them to implement clinical programs to see patients and to see that clinical side of pharmacy on the community side versus an institutional side. When I completed the community pharmacy residency program in 2007-2008, it was still in its earlier stages, so patient care hadn't quite taken off to the extent that it is now. We were doing a lot of MTM, medication therapy management. We were getting started in that. Kroger and the University of Kentucky already had a strong foothold in the immunization, in the area of immunizations, so we were doing a lot of that as well. I had a strong interest in diabetes care, so I was able to be part of the beginning of getting some of those programs started. So as a resident, I was given that opportunity to be able to see the program management aspect and program development aspect. And since that time, through the work that we did during my residency year, we were able to create a recognized through the American Diabetes Association Diabetes Self-Management Education Program. And now our residents, like I said, I'm a preceptor now for the residency program, and now our residents are able to have that wide variety of experiences. We no longer hurt to find patients. We have multiple patients. In fact, a lot of it is geared towards now getting our pharmacists in the community setting trained to be able to manage and see these patients and be involved in that direct patient care. Kentucky in general is a great place to live. I might be a little bit biased since I'm from here, but it's a beautiful area, rich in history. But as far as the pharmacy side of it, Kentucky is pretty progressive in what we're doing, especially in the community pharmacy side. We're working really hard with our state organization to get pharmacist provider status so that we can receive more recognition and reimbursement for services that we're doing. So that's one of the big pushes right now, is working to expand the role of the pharmacist and to provide pharmacists more opportunities. We're able to give multiple immunizations on standing order. We're able to, we're one of the first states that has initiated a diabetes educator license, trying to get more recognition and reimbursement for diabetes educators. So Kentucky's very progressive in our clinical services on the side of pharmacy, and we're only continuing to grow. I feel like the experience I had and the education that I had through the community pharmacy residency program has definitely helped me to be where I am today in my career. I'm also a certified diabetes educator, and part of that requires multiple hours of patient interaction and patient education, as well as taking an exam to get that credentialing. And I was able to obtain a lot of that experience through my community pharmacy residency program, through mentors and preceptors and pharmacy residency directors that I had. I was able to learn how to develop those skills and how to go about that process to become a certified diabetes educator, and then to develop programs such as the American Diabetes Association recognized Diabetes Self-Management Education Program. I'm now the program coordinator for that program through Kroger Pharmacy, and I was able to get that program started during my residency year and then just grow on that and implement that on a large scale after being done.